Hey guys, my name is Ryan and I am a hospice nurse. So I want to talk a little bit about hospice and why there is hospice, why we're here. So hospice comes in when there's a diagnosis or prognosis of 6 months or less to live. When the patient when the two doctors agree, when their primary or their cancer doctor and then our doctor, when they agree that more than likely they have 6 months or less to live. And once they're done with treatment options, chemo, labs, x-rays, that sort of thing, then hospice comes in. And we don't focus on curing anybody's disease. We focus on comfort. And we have our own team that does that. We have doctors, nurses, aides, social workers, chaplains. We pretty much come in, we take over care. We come in and we start seeing the patient. We assign them a case manager who is a registered nurse who comes out throughout the week. We have aides that can come out up to 3 times a week. And we have on-call nurses, which I'm one of the weekend on-call nurses. And so hospice has to have a weekend or has to have an on-call nurse 24/7 for any issues. And we focus on pain, shortness of breath, nausea, depression, anxiety. And we really just try to make sure the patient is comfortable, and we educate the family on what to expect, how to give meds, and how to take care of the patient so they will remain comfortable. Hospice is very aggressive with those, and we use a lot of pain medications. Our bread and butter is probably morphine, very concentrated morphine, and we use that for pain and shortness of breath. We use a lot of Ativan to help with anxiety, to help with restlessness or agitation. And then Zofran, we use Zofran to help with the nausea and the vomiting. One thing we do focus on as well is constipation, and we give out Senna. Anytime anyone has taken a opiate, we give them Senna to take every day. We also use a medication that's for oral secretion. It's called hyoscyamine or Levsin. And hyoscyamine is originally for cramps, for like diarrhea, cramps, that sort of thing. But the side effect is it dries up your mouth, and it dries up the oral secretions. So that's why we use it, because a lot of our patients with lung diseases or emphysema or COPD, a lot of times we'll get a bunch of oral secretions. And so we use that as another comfort med. So we get all these meds in the house. We get everyone on board. We assign a case manager to the patient. We assign them an aide. And we start out coming out probably once or twice a week. The aide probably a couple times as well, and we just start teaching the family on all these medications and what to do and what to expect. I would say 80% of our job is education. We are like constantly talking about medications and disease processes, and just what to expect, just all types of things, side effects, reactions, just It's really kind of interesting that we do so much education, because in nursing school, that we're all about education. Well, hospice is really the only job where I've educated this much, and so that's one of our big goals, is to make sure the family's aware of what's going on, and to cut down on anxiety and to cut down on worry. But we come in and we take over care. We start seeing the patients throughout the week. We have an aide that comes and helps clean them up. And then we have social workers, and they are there to, take care of anything social work take care of, living wills, papers, DNRs, that sort of thing. We have chaplains. Chaplains are able to come out and help pray with the family and be supportive. And then we have our weekend or our on-call nurses, and I am one of them. I work Friday, Saturday, Sunday, and 8 a.m. to 8 p.m. and I just take care of any needs that come up. I basically put out fires. My job is to do admissions when admissions come up, and to help the patient when there's shortness of breath, anxiety, when there's any of these problems where the family gets worried and they need some help. I go out, and they call us. I go out and I help them. Hospice is one of the most rewarding jobs I've ever had. To be able to help families in their time of need, it's really an amazing place to be. It's not for everyone, because obviously we see people die all the time. But it's kind of a sacred time to be there during this time, because we're really helpful. And so that's what hospice is in a nutshell. And I'll go through and do more videos about the disease process and other things, but that's just starting it off. See ya.